Welcome to today's Explainer. We're going to focus on clinical, evidence-informed pelvic floor physiotherapy for managing menopausal symptoms. Our goal here is to empower you with the physiological knowledge to truly understand your own body and to take an objective look at the clinical tools that are out there to help restore your comfort. Here's a quick roadmap for today. We'll be covering 1. The silent menopause experience. 2. Understanding the hormonal shift. 3. Symptoms you might notice. 4. How pelvic therapy helps. 5. A whole body approach. And finally, 6. Care at OVA Clinic. Let's get into it.
Starting off with Section 1, the silent menopause experience.
The foundation of everything we're discussing today really boils down to this. You are not alone, and these symptoms are absolutely real and treatable. Look, far too often, physical changes related to menopause get minimized or just brushed aside, right? But I want to reassure you that what you're feeling is an anatomical reality. It's thoroughly understood by specialists. This is a safe, educational space, and your experiences should never, ever be dismissed. Moving right along to Section 2, understanding the hormonal shift. Let's break down the clinical reality of what naturally happens in the body typically between the ages of 45 and 55. During perimenopause, your estrogen and progesterone levels start fluctuating. They gradually decline over a multi-year phase. Kind of a roller coaster, really. Then we transition to post-menopause. This marks the time after a full 12 consecutive months without a period, where your hormone levels stay low and tend to stabilize long-term. And both of these phases bring significant, highly measurable physical changes. Which brings us to Section 3, symptoms you might notice. But before we actually list these out, I want to pause for a second and ask you directly, does this sound familiar? As we go through these clinical symptoms, just take a moment to validate your own physical experiences. Let's look at the early signs of perimenopause. You might be noticing irregular periods, sudden hot flashes and night sweats, maybe some mood swings, or sleep disturbances. Clinically speaking, you might also experience vaginal dryness and a decreased libido. And here's the thing. These aren't just random annoyances. They are the direct anatomical result of those fluctuating hormone levels we just talked about. Now, as we transition into post-menopause, those symptoms often shift. Because of that long-term low estrogen, tissue elasticity naturally reduces. You might notice vaginal atrophy, which is really just a clinical term for the thinning, drying, and inflammation of the vaginal walls, along with urinary changes like incontinence. We also frequently see bone density loss, cardiovascular changes, some weight gain around the abdomen, and honestly, for some women, those hot flashes just keep right on going. So, what's the crucial takeaway here? It's that reduced estrogen directly changes your pelvic floor muscle function. It literally impacts the strength, the coordination, and the tissue elasticity in your pelvic region. And understanding this mechanical link, well, that's exactly how specialists begin to fix it.
Let's head into Section 4, how pelvic therapy helps.
Here's another checkpoint for us, addressing an incredibly common but heavily stigmatized physical issue. Can pelvic floor physiotherapy actually reduce pain during intercourse? Clinically known as dyspareunia, this happens when low estrogen causes dryness and reduced tissue elasticity. And the answer is an absolute yes. To treat that pain and dryness, specialized pelvic floor therapy works mechanically. It actively improves blood flow to the region. Therapists use manual therapy to relax hypertonic muscles, which really just means overly tight and clenched muscles that are causing you pain. They also provide targeted, guided education on the correct use of moisturizers, lubricants, and dilators, all while incorporating breathing techniques to help regulate your nervous system. It's a very hands-on, practical approach. And what about treating urinary incontinence and that uncomfortable sensation of pelvic organ prolapse? Because low estrogen can weaken pelvic tissues, therapy zeroes in on strengthening the exact muscles responsible for bladder support. It improves your muscle timing and coordination to help stop leakage. Crucially, it teaches pressure management and safe lifting strategies. That way, you aren't bearing down on weakened tissues, which significantly reduces that heavy, bulging feeling. Section 5, a whole body wellness approach. You know, it's really important to remember that pelvic therapy doesn't just happen in a vacuum. To maximize the benefits, you need a comprehensive lifestyle approach to back it up. Step 1 is regular cardiovascular and strength exercise to maintain your bone density. Step 2, a balanced diet rich in calcium and vitamin D. Step 3 is staying properly hydrated to support tissue health. And Step 4 is engaging in stress management like deep breathing or yoga. These daily habits actively sustain the clinical work you're doing in therapy. It's the whole shebang. Which brings us to our final section, Section 6, Care at Ava Clinic. The source material highlights facilities like OVA Women's Health Clinic in Burnaby, BC, as great examples of how this evidence-informed care is put into actual clinical practice. It operates as a women-only, specialist-trained environment. It's designed specifically to provide a safe, private space where patients are deeply understood, never rushed, and absolutely never judged for their symptoms. Facilities like this take a highly comprehensive approach. They use evidence-informed, gentle techniques tailored specifically for menopausal bodies. They look way beyond just basic exercises. They're addressing posture, tissue health, and your everyday habits. It truly is a whole body, whole woman perspective delivered in a deeply compassionate, highly specialized setting. The bottom line here is you don't have to keep living with this. Help actually exists. So many of these physical concerns go totally unnoticed until they seriously start affecting your daily life. But you deserve to feel comfortable in your own body, and there are trained specialists out there waiting to help you restore that function. If the clinical symptoms and treatments we discussed today resonated with your experience, I highly encourage you to take the next step. You can go ahead and scan the QR code you see right now to book a private, pressure-free assessment with OVA Women's Health Clinic. The sooner you start addressing the physiology, the sooner you can get back to feeling supported and strong. To close out our explainer today, I want to leave you with one final important thought to consider. Isn't it time you reclaimed your comfort and confidence? Your health matters. The biology makes complete sense. And true physical relief is entirely possible. Thank you so much for joining me to explore the science behind this vital topic today. I really hope you found this empowering, and I'll catch you next time.